We all put much trust in our medical system, but a physician is always limited by the power of the tests and therapies available. This is particularly evident in the treatment of bacterial infections. Gold standard bacterial diagnostics take days to generate results. This greatly limits physicians. They can't wait days, so are forced to make an educated guess solely based on a patient's symptoms when prescribing antibiotics. This is an incredibly inefficient process. It has led to 50% of all antibiotic courses in the U.S. being improperly prescribed. 50%. This is rampant antibiotic misuse, and it's worsening patient care and antibiotic resistance, and skyrocketing healthcare costs to the tune of $35 billion annually. Antibiotic misuse is a legitimate epidemic. Unfortunately, it's an epidemic with which I have firsthand experience. In 2006, I had an earache. I was paranoid it developed into an ear infection. So I called my physician and over the phone got prescribed an antibiotic. There was no test run, and I didn't need the drug, but I took it, and I paid a price. Because of a side effect and resulting complication, I eventually developed ulcerative colitis, a permanent autoimmune disorder I now have because I took that drug I did not need. There's an urgent need to change the way antibiotics are being prescribed. And this is exactly what we're doing at Nanopore Diagnostics, developing a rapid test for diagnosing bacterial infections to ensure physicians have definitive diagnostic information before making antibiotic decisions. We have a strong team attacking this mission at Nanopore Diagnostics. My name is Tom Cohen. I'm the CEO. I'm a scientist with some entrepreneurship training. My partner in the business, Dr. Christoph Bausch, has a background in the business side of life sciences. And we also have a senior researcher on the team, Somis Das, who we recruited from a faculty position in the UK. Guiding us, we have a board of directors and advisors with some significant startup experience. There's 5 highly successful exits among that group, and then 2 key R&D focused advisors. Dr. Li Guanggu, who's the inventor of the technology platform that allows for our rapid tests, and then Dr. Gregory Storch, who's a key opinion leader in the bacterial diagnostic space. The tests available today to physicians like Dr. Storch to diagnose most bacterial infections include the gold standard culture analysis, think Petri dishes. This is comprehensive but takes days. Newer, more cutting-edge tests can diagnose in 18 hours. Our proprietary technology, the indexer, allows for a test which can diagnose a bacterial infection in 30 minutes and at the point of care. This would enable physicians to make informed treatment decisions during initial patient exams. The indexer technology is a rapid sensor for counting bacteria in a raw clinical sample. The diagnostic test that we're building with it, we plan to initially launch into the emergency medicine market, as it's here where the need is greatest. We're going to focus on sepsis patients who have life-threatening infections that need immediate optimal treatments. After adoption there, we plan to expand into other hospital and private practice applications where antibiotics are prescribed. Moving into our commercialization plan, we closed on a seed round of funding last year and developed our clinical assay on our initial indexer instrument, which functions on a benchtop. We've also got a non-clinical service for researchers that we developed, and through partnership with Horizon Discovery, we're going to launch this year. This is an outstanding opportunity for us to generate early revenue for clinical trials. Moving forward, we plan to, through subsequent funding rounds, build a commercial-ready, portable version of our device, and then move into FDA trials, after which we plan to pursue 3 clinical acquisition exit opportunities, and then through that partnership, launch into hospitals. So I thank you for your time and your attention, and for the opportunity to pitch today. My contact information is here, whether as a potential mentor, partner, or investor. Please get a hold of me if you're interested in talking more about our efforts and taking the guesswork out of prescribing antibiotics. Any questions?